Today, I'm joined by Martyn Rogers. He's the Chief Executive of Age UK in Exeter. He's been a consistent and stable feature on the health and social care scene in Exeter for nearly 30 years now. Working with his team of volunteers, he supports nearly 1,000 people every week, supporting them with benefit management, debt management, activity and social groups, as well as practical help and support at home and for those living with dementia and those caring for people as well that are living at home. From my point of view, I've known Martyn for nearly 13 years now. I'm initially as a health and social care manager across Exeter, but now in my role as director at Bluebird Care. So Martyn, thank you so much for joining us today. Really appreciate your time.
That's good. Good to see you, Will. And I should say, we also have, as well as having 300 plus fantastic volunteers,
yes,
we've got 100 plus wonderful staff.
Amazing.
Who are a real credit to us and to the city. Definitely.
And that's a really good point, isn't it? You're actually a very large venture across the city. And I'm not sure that people necessarily would have an idea of the scale of your organisation.
Well, we've grown a lot over the years, and we now have, yes, 100 plus staff, over 300 volunteers, and I guess provide support and opportunities to, well over 1,000 to 1,200 older people each week in the city. Of course, that was before what happened on 23rd March.
So let's start there, Martyn. I wonder how this pandemic has impacted older people in our local communities.
Well, it's been massive, hasn't it? Absolutely massive, because it's changed people's lives. It's changed what people do. People have been told to stay at home. Most of the people we work with are over 70. Many of them have underlying health conditions. So most people have been abiding by the guidance and staying home. So they haven't been seeing friends, haven't been meeting socially. Contact with families has been problematic for many. I mean, families have been great and really, obviously, stepped up to support their elders, but that social distancing comes in, so that's difficult. Yeah. Terribly hard for older people who've got grandchildren who can't give them a hug, can't see them maybe. You and I maybe are able to Zoom with family or see them virtually. Many older people we work with don't have access to the internet, so their world has changed, and it's been difficult. But I suppose what I'd also say is just how amazed I think we've all been by the resilience of the people we work with. A lot of older people obviously have been through a lot. Their years have meant that they've been through a lot. And while, you know, we know this is unprecedented, you know, none of us have lived through anything like this. I think a lot of older people have been very stoic and shown a lot of fortitude and tried to take it in their stride. And that's a real credit, you know, to them and to our society in a way. So although lots of them, you know, obviously they want to get back to normal. We all want to get back to normal. And certainly the people who were receiving services from us, our group-based services, are desperate to get back again. So it's been tough, and it stays being tough. And particularly as well for those families and carers who perhaps used to be able to, well, who did access services to support them, but some of those services have now stopped. So particularly for people living with dementia, I think that's been very hard. And it's been very hard for people whose loved ones are either in care homes or in hospital. When you can't visit people, you can't see them, that's heart-wrenching. So it's been very tough for some.
And Martyn, would you say that you've seen an impact in terms of isolation and loneliness?
Yes, inevitably. And I think a lot of us have been really worried about that, about what that does to people's mental health. Because so much of what, well, in a way, so much of what you and I do, the byproduct of what we do, well, for us, maybe it's more a real focus about bringing people together and combating loneliness. But whatever we do, and certainly what you do as well, is about combating that loneliness and isolation. It's somebody, it's a connection, it's an engagement, it's a relationship. And so just like us, your staff don't go in and just do a job. Your staff go in and make a difference for someone. A positive relationship grows. People look forward to seeing them. It brightens their day, gives a bit of light and shade, keeps them connected with the outside world. All those things that are so important, because what we know is the longer people are on their own and isolated, the more likely it is that people start to feel a bit anxious. Small problems become bigger problems. They worry about things. The more time we've got to think about things, the more we can worry. And so having those connections is really important for people, and that's why we've concentrated very hard on phoning people on a very regular basis. Some people get a phone call every day from people they know from us, to keep them connected. So that's not just a welfare check, although it does that as well, but it's actually a much longer conversation and chat. It brings a bit of life into their lives.
And so, Martyn, picking up on that point, obviously this has had a massive impact on the services that you're able to deliver at Age UK Exeter. Tell us a bit about the services that you're still able to provide to people, and how many people are you now supporting?
Okay, so overnight almost the world changed, didn't it? And because of so much of what we do is about bringing people together, all those group-based services, day services, daycare for people who are physically frail, daycare for people with dementia, lots of social and activity groups, 20 different groups across the city, our Men in Sheds project for older men, lots of things like that. Our community cafe all had to stop because that all involved people coming together. So those have gone, and we then moved very quickly to providing a one-to-one doorstep delivery service, really, of shopping and prescription collections for people who didn't have other forms of support. So we've been working in a coordinated way with others in Exeter to ensure that everybody gets their needs met. So I guess there are two groups for us. There are existing clients, many of whom, because we're already supporting them, don't have family nearby, and rely on us for so many things. So we have quite a large enabling service that supports people in their homes, and was doing things like assisted shopping with them. So we're still supporting a lot of those people. We're supporting a lot of people who were coming to our day services but now can't, by providing, as I say, shopping for about 120 people a week, and also telephone calls, regular telephone calls to people, and that's probably, I don't know, around about 400 people, maybe more, who we're keeping in touch with. Some of those are older people themselves. Most of them are older people themselves, but also we run a big project for carers of people who are living with dementia. So we have a coordinator who has been phoning and supporting those carers during lockdown, and often providing advice, but often just providing a listening ear, is what is so important for people. Our information and advice service is still functioning. So we can help people with benefits. We have to do it all remotely and that kind of thing. We've been running a triage system where we have a member of staff who's on duty each day. So calls as they come in can be handled by our duty member of staff, and the appropriate solutions found, whether that's us or putting it out to somebody else.
Right.
So a whole range of different things, but all focused on meeting the here and now, which is about providing emotional support to people. We've developed a newsletter and activities booklet for the people who come to daycare, so they've got something to do, and then we can chat to them, and we can have prizes about who gets, who solves the word quiz best, and all that kind of so it's still trying to connect with people, but just having to do it remotely.
Yeah. So actually, in fact, you're still extremely busy, but just in a very different way.
Yeah. And of course, we're all working. Most of us are working from home. We've got wonderful staff who are out in the community. With supermarkets and doing the shop and all that. Most of us are working from home. We've just brought a couple of people back into our main office in Carrick Street after doing thorough risk assessments and all that, because they can work much more effectively and efficiently from there than they can from home. And we've got a fantastic administrator and senior receptionist who had our phone lines diverted to her home.
Oh gosh.
And at the beginning of all this, we were receiving 200 calls plus a day from people. It was massive. Now we're down to maybe 80, 90 calls a day. So I think people have found solutions for themselves, and it feels like we're entering a bit, I don't know how it feels to you, but a bit like the new normal now. And we can be more proactive than reactive. And that's a good place to be.
That leads me into my final question, Martyn. You're talking there about the new normal. So as lockdown restrictions are evidently easing, what would you like people to consider to make sure that our older people in our local communities don't remain isolated, or that we don't forget some of the lessons that we've learned through this process?
Well, I think we have to recognise that this isn't going to go away anytime soon. We're stuck with this for a bit, and so people will continue needing that support. And I suppose one fear might be that we see a bit of care weariness, if you like, or concern weariness from neighbourhoods and local communities. What I'm sure will happen is that people continue to look out for others and to support them in the best way they can, while we are doing our best to try and remodel our services to make them as effective as we can to meet those needs, and see where we as a charity are going to be in the next 3, 6, 9 months, because for many of us the world is going to change quite a bit, and we need to start working with all our partners, Devon County Council, CCG, other providers. We all need to be thinking about how we can shape the new offer that will need to be designed to ensure that people are safe, but not only safe, that people can make the most of their lives. Because I think one of the sad things in this is that there are people who think, because of all the restrictions, that maybe they're thinking that the relatively short time they have left they won't be able to use to best effect. And I know from people I've spoken to, there is a feeling of that. There are people who wanted to travel who can't, people who are desperate to see their grandchildren, in different parts of the country and all that. And we have to try and get to a position where we can support people going through all that and still help people to enjoy life and get the most from it.
Martyn, to close, I've asked if you have a particular quote or a thought that you'd like to finish on.
Well, I think it's about hanging on to let's hang on to some positives from this. And I think it's hanging on to the positive that we may, when we come out of this, or as we gradually come out of it, in some ways we may be a better society for it. Because I think for a lot of people, it's what we've been going through has changed priorities a bit.
Yeah.
I think people have been thinking more about families and friends and what it means to be connected to each other, rather than this just mad scramble that is work and pressure and blah blah blah. So if we could end up with a slightly kinder world, where we all take just a little bit more time to connect with others and to recognize the impact that has, particularly for those people who don't have a wide social network, then if we can hang on to that, then that will be a positive that comes from this. And I sincerely hope we do, and I think we will.
Yeah. Well, Martyn, that's a really positive note to end on. And, you know, certainly from my point of view, I've got a lot of respect for what you and all of your colleagues are doing. So thank you for all your tremendous hard work and clearly for adapting to this situation so swiftly. So thank you for taking time to talk to us today.
Pleasure. Nice to see you, Will.
And you.